Hello, for those that don't know me, I am Dr. Amanda, and again, Happy New Year. We'll probably say that for, at least the next week. But I am the owner and CEO of Adkins Enlightenment Lifestyle Medicine, and I'm so glad to be with you today to talk about healing. And before we get into that, though, I want to have you guys type, if you're watching live, say hello. If you're watching the replay, put in hashtag replay so I can, see who's on. And if you, of course, if you have any questions along the way, please feel free to put them in the chat. And I'll be looking down just to make sure I don't see any messages in the chat along the way. Okay. So let's see here. Let me make sure I got this here. All right. So, um, from the start, I already said we're going to talk about healing today, and healing is possible. Okay. um Sometimes we just feel like we don't have the hope once we have a diagnosis, but that healing is possible. It's not just about maintaining numbers, it's not just about adding in more and more medications, but real healing is physical, metabolic and emotional healing. Okay, so this message today is especially for you if you're living with or at risk for prediabetes, diabetes, or high blood pressure. And I really like to focus on these because, again, these illnesses affect our community so much. And most of the time, we just think that medication is our only choice. Okay. So you'll hear me harp on these three pretty much every time I come on. But today, I'm going to walk you through 5 foundational steps to healing, the same framework I use for patients that are in my own virtual practice. And your body is designed with an incredible capacity to heal when given the right environment. Okay. So, again, our bodies are miraculous and healing is possible. Okay. So, I talked about this a little bit earlier this week, but traditional medicine often focuses on managing disease. And we get a lot of pushback, a lot from patients because they're like, you just want to keep me sick. You want to give me all these medications. And that's what we were taught to do. We were taught to diagnose and we were taught to treat either with procedures or with medications. And we're just managing an illness and not necessarily really focus on healing. And lifestyle medicine usually goes a little bit deeper and asks, like, what is happening in the first place? Okay. Healing means addressing more the root cause and not just controlling symptoms. And it's, more of restoring that balance and not just watching labs and numbers. So what does healing look like? First step is that we want to make sure that we change our environment. Okay. This is not about having willpower. Healing does not start with motivation, it starts with the environment. You may at first think that you have, like, because it's New Year's, if you're watching this live and you're like, oh, this year I'm really going to do that. And you, like, I've tried this before, and you try to push through, like, with your own willpower. But as you unfortunately have seen in the past, it may not always work. And it's not because there's anything necessarily wrong with you. That's how the human body works, how our human mind works. And we want to give you other tools that you can actually use that is not just dependent on willpower. Okay. So, with changing your environment, your food is your environment, your stress is your environment, your sleep is your environment, your social interaction is your environment. So, we want to look at all those things. And so, when our body consistently feels under threat, healing is difficult. Okay. When we remove daily stressors, though, it makes healthier choices easier and the body can finally respond. Okay. So, the step with changing your environment alone improves your blood pressure, your blood sugar, energy. Oh my gosh, so much more energy before medications ever change. Okay. So, step one is changing the environment. So, healing starts with your environment. Okay. Next, we want to talk about heal through nourishing foods. So we talk about food as the environment, but also healing through nourishing foods. And if you've seen any of my videos, you know that I love talking about nutrition, and especially nutrition that actually gives us nutrients that our body needs and actually helps us and not harms us. Okay. So food is information, and every meal sends a signal to our cells. Okay, so every time we eat, it's either saying yes, this is good, or no, this is bad, or somewhere in between. So healing foods actually helps improve our insulin sensitivity, because again, we're focusing on people with pre-diabetes, diabetes, and high blood pressure, but food can do a lot more. It can actually reduce our inflammation, which most chronic illnesses starts with inflammation. It supports our gut health. And there's a lot of connection between gut health and chronic illness. And then it also can stabilize our energy and decrease those cravings. So I don't know about you all, but over the Christmas holiday, as I talked about even before, it's like you just want to go in with intention, but sometimes you still overdo it a little bit on those sugars, and those cravings follow you. Okay. So actually having nourishing foods can help stabilize those cravings and decrease those, okay, over time. And this is not, again, about being perfect. It's about being consistent and being nourishing to your body. Okay. So when food becomes support instead of stress, because certain foods definitely can stress our body, foods that are high in fat, high in sugar, with low nutrients, low in fiber, those types of foods stress our bodies instead of support our bodies. So when we actually eat food that supports our body, then our body begins to respond with healing. So I know that many of you out there, like me, have actually, felt this. So when we actually start to eat too much sugar or too much fat, we start to feel like, oh, I need to lay down. I need to lay down. And that just doesn't feel good. But then when you start to eat like foods that are light and fresh and whole, you're like, oh, you start to wake up a little bit. And that is the power of food. So just think about that every time you actually eat a meal. So it's like, is this actually supporting my body, or is it stressing my body? So we just want to look at it like that. And again, it's not about being perfect, but we just want to try to be consistent as much as possible and try to make progress as we move through these different steps in supporting our body. Okay. Excuse me. So the next step that we want to go through is to try to not stress out our nervous system too much. So we want to regulate our stress. So this is not necessarily with food stress. This is like other stress. So you could eat well. So eating to actually support our bodies through food. But then we can still struggle with our nervous system constantly feeling like a fight or flight. And excuse me, sorry, let me get a drink of water. My lemon water there for the morning. But if we are constantly in a fight or flight mode, that chronic stress actually raises our blood sugar and blood pressure. And it's not a good environment for our actual body to heal. Okay. So think about, maybe you were a person that overdid it with spending over the holidays. And now you're like, oh my gosh, how am I going to pay for all these things that I shouldn't have bought? Something of that nature. Or there's a lot of changes in the job system, and like wondering, am I going to have a job this year? Or, there's different stressors in the family that you can't necessarily control, like what's going on. And we don't necessarily want to be in that fight or flight mode all the time, because that chronic stress, again, does not support the healing that our body needs, especially when we are looking to heal from chronic illnesses, again, like diabetes, high blood pressure, and pre-diabetes. Okay. So when we're looking to heal, it requires safety. So when you feel safe, then you're more likely to heal. Okay. So that includes sleep, that includes setting boundaries, that includes making sure you're breathing, and not just like, of course, Dr. Amanda, I'm breathing, I'm, alive, but intentional breathing, like not all the shallow breathing, but taking deep breaths all throughout the day. We want to make sure that we're slowing down, and not necessarily where we're not doing any type of movement, because we're going to talk about movement later. But to not always be on the go, like go, 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 go. And again, this is something that I felt like Christmas holiday for me was like a whirlwind. Like we were always moving, doing something. And it's like, oh my goodness, now it's just time to settle down. And I know some of my other friends were talking like they had, house guests, and it's like it was always, on. You were always on. You were never able to, turn yourself off or, slow down. And now it's about restoring the rhythm that we had before. So we feel safe and actually can start that healing process. Okay. So as we're moving along, that was step 3. We have, 2 more steps to go. I just want to make sure that you like the video, share the video with your friends, because there's so many people that definitely can use this message. And a lot of times when I am actually on here, it like, helps me to really stay on track. Also, so I always tell people I love talking about this because, again, in kind of a selfish way, it's like it helps me to remember what to do to make sure that my body is healthy and healing. And then so I can actually carry out my purpose and actually help others to do the same. So please share this video with your friends and family so they can actually learn about this information too. Okay. All right. So that was step 3, regulate our stress and nervous system so we're not always in that fight or flight mode. And then we want to make sure that we are moving on to make sure restoring the rhythm, slowing down, because when stress hormones decrease, because that cortisol is high when we're stressed, then the healing hormones rise. So we want to decrease the stress so our healing hormones rise. Okay. So I alluded to this before, but the next step to healing is movement. Okay. So movement is medicine, and movement, when it's used as medicine, actually helps to support healing. So we want to actually move. Again, we don't want to be stressed about moving. So we don't necessarily want to overwork our bodies, but we do want to move. Okay. And I want to, really stress the importance of the difference between exercise and movement. Okay. So exercise is a type of movement, but it is a set time and intentional movement. And it's really where you're actually working to get your heart rate up. So it actually can, burn calories, stress out the muscles in a good way. So that way it actually starts to form muscles. So you need your muscles for like being able to balance, being able to continue to walk, and to move throughout the day and through the years, and to actually get those joints moving and all that. So we want to actually keep that movement, and we want to actually have the difference between exercise. So we want to actually set time to exercise, an intentional time set aside to really get our heart rate up. And then we also want to make sure that we're moving throughout the day. And I always kind of snicker when I say that, because I'm sitting here on a video and not really moving, but I just did some movement before this, and I'm going to do some movement after this. So it's okay. And hopefully you're listening to this and you're moving around as you're listening. But we really talk about how movement now, our lack of movement is like worse than smoking at this point in time, because we're so inactive as as a country, and as a community, that we're so focused on, because technology is keeping us just stationary. So we want to try to incorporate movement into our daily routine, in addition to doing exercise. Okay. So again, movement should build you up and not break you down. And again, we want to focus on consistency and compassion when we're moving. But then again, when we're exercising, we really want to push it at that time. Okay. So movement can promote healing. It improves our mood. This is good. It reduces inflammation. Okay. So again, inflammation is big when we want to try to get rid of that with chronic illnesses. Okay. And then step 5. Now, how would I not include this, right? We want to partner with a physician who has time, right? Because healing takes time. It takes strategy and it takes partnership. And that's why I created 100% virtual cash-based lifestyle medicine practice called Adkins Enlightenment Lifestyle Medicine, to where you can work directly with me, partner with me as I partner with you to help with the healing process. Okay. With the practice, we removed insurance because I wanted to remove the middleman. I wanted to make sure you had visits that were meaningful and not just like looking at numbers and going on. I wanted care that was personalized. So it's not a one size fits all. There's many things that may be similar, but then there's few tweaks that really help when people are honing in on healing, because the human body is the same, but every person is different. Okay. So we really wanted to focus on that with Atkins Enlightenment Lifestyle Medicine. And then we wanted to be able to base our decisions on your health and well-being and not just billing. Okay, because in the beginning we talked about traditional medicine, how we were managing illnesses. And again, the more illnesses you manage, the higher the billing would be. So we didn't want to focus on that. We wanted to focus on actually helping with health, wellness, and healing. Okay. So the virtual care covers a deeper conversation and a real partnership, not me just telling you what to do or you're saying I'm not going to do it. And then we just go on after the 15 minutes and maybe meet again in 3 months, 6 months, just to have the same conversation again. We don't want that. We want the support to heal and actually go. So if you are interested and ready to move beyond disease maintenance, managing illnesses, and begin focus on healing, then I invite you to work with me. You can come, and again, it's a virtual practice, so it's very easy to schedule appointments. You don't have to take off time from work. You don't have to go into traffic. You don't have to, wait. I said, I talked to a patient the other day that said that, he was trying to get in with his primary care doctor, and he wasn't going to be able to be seen for over a month. What? I mean, that's the way it be sometimes. But we want to actually have that actual time for you to be able to come in and focus on improving your blood sugar, improving your blood pressure, and long-term prevention of illnesses. So you can actually go to my website. I put it in the chat at www.dramandamd.com/services. So that will take you directly to the services page, because your health is worth investing in, and you don't have to do this alone. Okay. So come join my practice so we can work together. And that way you actually get the personalized care that you need to actually work towards healing. We go beyond the numbers. Okay. So before I close today, I want you to walk along with me and imagine something that's not lab values, not diagnoses, but life. Okay. So you stopped organizing your days around managing medications, like I got to check this, I got to check my blood sugar, and the fear of what's going to happen next. Imagine instead waking up with real energy and not just getting through the day hoping to enjoy it. Okay. Imagine traveling, celebrating, playing with your children and grandchildren without worrying if your body's going to cooperate or not. Like, oh, wait, let me see if I'm going to be able to move. Imagine food no longer feeling like the enemy, but something that nourishes you without feeling guilty or feeling anxious about it. Imagine trusting your body again, believing that it is resilient and capable of healing when it is supported. And imagine not just adding years to your life, but adding life to your years. And I heard that from a mentor of mine. I'm like, that is what life is about. We don't just want more years. We want to add life to the years that we do have. And imagine just being present, clear-minded, steady, physically able for the people and the purpose God has placed in your life. This is what healing really looks like. It's not instant, it's not perfect, but it is possible. All right. Thank you all for being here, and blessed health to you all. And I look forward to seeing you next time.